Welcome to the Ardaling TV channel. Please like and subscribe to my channel and press the bell icon to get new video updates. India is the second most populated country in the world with nearly a fifth of the world's population. According to the 2019 version of the World Population Prospects, the population stood at 1,352,642.280 billion. India's deadly COVID-19 second wave has devastated big cities like Delhi, Mumbai, Lucknow, and Pune. Hospitals and crematoriums have run out of space and funerals are taking place in car parks. But the pandemic has now firmly gripped many smaller cities, towns, and villages where the devastation is largely underreported. In Kota Rajasthan state, the city and surrounding district has reported more than 6,000 cases in the past week and 264 deaths since the pandemic began. But 35% of those happened in April alone. Up to 7 April, it was taking 72 days for the number of cases to double, but now it's 27 days. All oxygen beds were occupied and only 2 out of the district's 329 ICU units were free on 27 April. There is an acute shortage of oxygen and drugs. The district is home to many coaching centers for students from all over the country taking exams to get into prestigious medical and engineering colleges. But the students have left and the district is now in turmoil and largely away from the radar of national and international media. In Allahabad, Uttar Pradesh state, the city also known as Prayagraj had recorded 54,339 cases up to 20 April, but it has registered a 21% increase since then, adding 11,318 cases in the past week. 614 deaths in the city happened in April alone. There is no official data on healthcare facilities in the city, but several people said they have been unable to find a bed for their loved ones. Several calls and written questions to the city's chief medical officer about the shortage of beds went unanswered. A senior journalist in the city said the actual death toll was much higher as cremation and burial grounds were functioning day and night. Yogi Adityanath, the state chief minister, recently said there was no shortage of drugs, hospital beds, or oxygen, but experts say the reality on the ground is vastly different. Social media is awash with posts from people from the state pleading for beds, oxygen, and drugs like remdesivir. The chief minister has also warned the action will be taken against any private hospitals that falsely reports an oxygen shortage. There have also been reports about deaths due to oxygen shortages in the state. Several other districts and villages in Uttar Pradesh are also reporting that hospitals have run out of beds. Why second coronavirus wave is devastating? Data suggests that this wave is proving to be more infectious and deadlier in some states, although in India's death rate from the virus is still relatively low. But the country healthcare system is crumbling amid the surge in cases. Doctors say it's hard for them to see the light at the end of the tunnel this time. Big religious gatherings, the reopening of most public places, and crowded elections rallies are being blamed for the uptick. Experts say this rapid increase shows the second wave is spreading much faster across the country. Dr. A. Fatahuddin, who is part of Kerala State's COVID task force, said the rise was not entirely unexpected given that India let its guard down when daily infections in January fell to fewer than 20,000 from a peak of over 90,000 in September. Big religious gatherings, the reopenings of most public places, and crowded elections. Dr. Fatahuddin said there were warning signs in February, but we did not get our act together. I said in February that COVID had not gone anywhere and a tsunami would hit us if urgent actions were not taken. Sadly, a tsunami has indeed hit us now, he added. A false sense of normalcy crept in and everybody, including people and officials, did not take measure to stop the second wave. India has been consistently reporting more than 150,000 cases for days now. It reported 400,000 cases on last Monday, the biggest daily spike since the pandemic began. Badly affected cities like Delhi, Mumbai, and Ahmedabad have almost run out of hospital beds. The situation is not very different in other cities such as Lucknow, Bhopal, Kolkata, Allahabad, and Surat. Public health expert Arnav Ban says officials did not use the lean period to boost facilities. We didn't learn any lesson from the first wave. We had reports of some cities running out of beds even in the first wave, and that should have been a good enough reason to be prepared for the second wave, he said. Thank you for watching the Ardaleen TV channel. Don't forget to subscribe and like our video for more updates.